It's wonderful to see everyone in person and finally connect with all these different groups across the region. I'm going to give an overview of the studies that my lab has been working on in the last couple of years, and then some discussion about next steps and then what we're looking forward to. So this is just a little bit of an overview of what my lab focuses on and how we think about our research. And basically, over here you have beautifully constructed randomized trials where you control everything and you have picture-perfect data. And you get a number here that says, oh, your efficacy is 98%. And then you walk out and you try run a public health program. And at each one of these steps, you lose 10% or 20% or 30% based on coverage or uptake, or people don't like the intervention and don't use it, et cetera, et cetera, et cetera. And you get down here and your effectiveness is 37%. So these are not real numbers. This is just a hypothetical intervention. And so the thing I like to think about is how do we identify what those gaps are and then develop public health programs that can mitigate those losses. Because there's tons of beautiful clinical trial data that has very little, or like randomized trial data that has very little applicability to impacting public health. And so this very often involves a lot of diverse study tools to work with populations to understand what the barriers are to moving this relatively, unimpressive number to something closer to a beautiful trial. Okay, so this is the main project we've been working on. So ITCH has a bunch of different components, and we talked a lot about the tick sampling. Paired with that is a long-term internet-based survey looking at knowledge, attitude, and practice among participants for their knowledge about ticks and mosquitoes and kind of what they do at the residential level to control that or don't, depending on who they are. So this is kind of also looking at risk factors for recent tick-borne disease within households. And then Project Listen is a qualitative study looking at workforce challenges and management across the vector-borne disease professional landscape in New England. And so we'll talk about it a little bit. And then the spatial epi of tick-borne disease in Western Mass. So this is building on an R21 that Steve and I put in pre-pandemic. And then we have a bunch of follow-on studies with NEWVEC. And then last but not least is this ITCH research support. So that's been a lot of the research management and IRB submissions have been a lot of time and energy. And then we're also getting all of our tick data into the CDC ArboNet. And that's been a little bit of a challenge because CDC is set up to get it directly from state DPHs. And so they have like a direct portal. And so we're kind of outside that usual reporting system, but we're going to get all of these tick reports into the CDC database, which hopefully will fill some gaps. Okay, HKIP. So the idea here was that aside from some fairly geographically limited studies, we don't have a great sense of the knowledge, attitude, and practices for people about residential vector control throughout the region. So we wanted to try and understand some of the gradients, both socioeconomic and ecological across the region, to just see how feasible and realistic a lot of vector control at the residential scale is. And so this is about a 10 to 15 minute survey. This is the main landing page. And so this is kind of the general sets of questions. We also capture the household size and whether they have pets and how recently they've had tick-borne disease or mosquito-borne disease, et cetera, et cetera. So there's a really rich data set there that we're delving into. And so again, all of these data are from all of you, and you're driving using the bushes to get respondents in your respective states. So there's been incredible amounts of work to get an absolutely stunning sample size. So we've had 6,700 people who have at least started the survey. Some of those did not finish the informed consent or their modules that they chose to skip, but still that's a huge sample size for this kind of study. Massachusetts and Maine are running neck and neck at the top of the leaderboard. And then we have a little bit further. So the others are a mix of mostly New York and then a couple New Jersey, and then there are people from California and kind of random places that somehow got a link and decided to answer it. So the others we probably won't include in the final analysis, or we'll do a sub-analysis because whatever ways to answer the questions are not particularly relevant to our specific questions. It's good to see that people outside of the region are interested. So I'm going to give two big overviews here. The question is, mosquitoes are a big problem, ticks are a big problem, and then it's a Likert scale from strongly agree to strongly disagree. And out of the 5,586 people that answered those questions, the vast majority of people for mosquitoes were more in the strongly agree, and for ticks, it's in the top category. So there is some variation in terms of the level of qualitative, semi-quantitative worry about the respective vectors in people's households. And then this is a little bit of a busy slide, but basically these quadrants, or whatever that would be for 16s, is color-coded by which area people responded to by state in terms of the highest. So in Massachusetts, people are more or less equally worried about ticks and mosquitoes. So that's why this top box is shaded. Whereas in Vermont, there's a stronger worry about ticks and a slightly lower level of concern for mosquitoes. And so there is definitely some regional variation in terms of the relative importance of those two. I bet if we did kind of a longitudinal analysis, you'd probably see if there was a lot of Tripoli or West Nile reports, you'd see a shift in where that is depending on just people's level of interest. But it does show that there's probably a need for fairly targeted public health messaging. Just saying, watch out for mosquitoes and ticks may need a little more nuance. I mean, certainly COVID has suggested that nuance in public health messaging is really difficult, but we should at least try. Okay, and so Fatma will give a turbo talk on some of those further results from this Project Listen. So this came out of the realization that there's very little in-depth understanding of what parts of the vector control professional landscape are working well and what's not working as well as it could. And in some cases, this is especially exacerbated by the different public health systems across the states and the region. And so this is developed as a way to try and probe all of those people who have a lot of really important information about what works and doesn't, and use that to try and develop policy suggestions that can help vector control work better across the region. So it's a combination of focus groups and key informant interviews. So focus groups is 6 to 9 people, or 10 or so you sit around, and people can kind of bounce ideas off one another. You get very interesting social dynamics. And you very often find out things you would never even think about putting into a survey. And that's why this thing is really important, is that you can explore themes that help you develop a subsequent survey to ask questions that are directly relevant. Because we can all guess what are probably the problems, but we talk to people that are doing it day to day, and that's not the problem at all. Yeah, and so key informant interviews is a more focused one-on-one interview with someone who has very specific domain knowledge. So Johanna's going to give a turbo talk on all of her initial results from the first couple rounds of sampling, or first couple rounds of sampling. And so quickly, there are kind of 3 tiers of interviews that we're working on. At this top level are the kind of boots on the ground public health or entomology or vector control staff in terms of implementing the programs. This mid-tier is kind of a higher regional or county level position that may have some more supervision or kind of general policy. And then the top level is the state level legislators and DPHs, and that level of kind of higher level oversight. So we're working our way, I should say Johanna is working her way through this very complicated scheme. Okay, and then I'm gonna also talk about spatial case control. So this is a project that was started pre-pandemic. And there's this idea that there's this Pareto distribution, which is 80-20. So for a lot of parasitic diseases, 20% of hosts have 80% of the parasites. And that general rule holds across a lot of different scales. And so talking to clinicians here, there is this idea that a very small number of trailheads may be seeding a lot of potential tick exposures. And the idea was if we could find a way to identify those, and then we would have a nice targeted area to do really intensive tick control. So we're basically enrolling people who have recent tick-borne disease as probes of ecological areas that may have especially high human tick overlap. So these are GPS data loggers. They record GPS coordinates, but they don't transmit. So this was kind of important from an IRB standpoint because people could hand us the thing. If they really didn't want to share where they went, we could delete the data. No one had any concerns, which was pretty cool. So we got lots and lots of data. And yeah, so that's all of that. And we enrolled people who had recent tick-borne disease or attached tick from clinics, and then people who had any other condition. So we kind of excluded people who had a broken leg or mobility issues that would impact their ability to collect data. So 634 people completed the screening. Just under 600 actually did the informed consent and went through that whole process. We got 211 data loggers back. Some of them had kind of corrupted data or were limited data. So at the end of the day, we got 193 person levels. This is 2 weeks of sampling all of their locations outdoors in potentially tick exposure areas. So there's just under 1 million data points. And we filtered out people's houses, directly over their house for privacy issues, and then anytime they're over, in the car. So what do we do with all this? There's a lot of statistical tests that let you look for patterns in spatial data. So the one we're using is called TAT-SCAN, which basically says if your cases were randomly allocated across the landscape, what would that pattern look like? And then it compares the patterns that you give it against that completely uniform background. And there's a lot of fancy ways it adjusts for multiple testing. And so from this, we can get hot spots and cold spots, which are areas of higher potential tick human exposure versus the baseline, as well as cold spots, which are lower risk. So these are what the data actually look like. So these are a preliminary scan of all of the region. So we did constrain people having to live within a reasonable geographic radius of Amherst to keep the spatial scale reasonable. And so from after all of our data manipulations, we then got this map, which shows the hotspots that we are most interested in. We did not see any cold spots in these data. And so James is going to have a work in progress a little later this semester to go through all of the spatial epi in detail. And following on from that, we identified all of our hotspots. And so in some cases, the actual hotspot that was there was so it's kind of this arbitrary point in space or in the landscape that may not be directly accessible in terms of permitting or logistics, or if it's in the middle of a swamp. So we picked a 500-meter bubble around all those and identified the best sampling location within that radius. And so Vera's going to give a talk about the follow-on studies, which is looking at vegetation indices. So this is developed with Bill's group and Allie's group. We have all his permissions in place, and we're currently sampling at a range of those sites to try and understand the spatiotemporal dynamics of ticks, as well as getting some parallel vegetation indices for all the work that we're going to do here.